So again, welcome everyone. We're really glad that you're here with us today. My name is Scott Johnson, and I'm a senior community manager here at Blue Circle Health. I've lived with type 1 diabetes for over 45 years, and in that time, I feel really blessed to have seen so much change and progress in diabetes technology. And if there's one thing I know for sure, it's that diabetes technology can be incredibly helpful, but it can also feel incredibly overwhelming. So we're often told that new tech will make our diabetes easier, and I do agree with that for the most part, but I also think it's important to acknowledge that choosing, switching, or even just thinking about diabetes technology can feel a bit confusing, maybe a little exhausting, and sometimes very emotionally loaded. So I'm really especially excited about today's conversation with the team from DiabetesWise. This isn't about pushing the latest device or convincing anyone that they should be using something different. It's really about helping all of us make informed, realistic decisions that actually fit our lives with diabetes. Before we get going too far, I do need to cover some quick housekeeping items, and then we'll get started. We welcome and encourage you to use the chat feature along the way. I'll keep an eye on it throughout the session if you need anything during the presentation. This session is being recorded, and participation in this event is completely voluntary, and anything that you may share in the chat may be visible to others. We're also not providing any medical advice, and for personalized guidance, we'll always encourage you to talk with your healthcare team. And finally, for anyone who is not familiar with Blue Circle Health, stick around until the end and I'll share a brief overview and then answer any questions that you may have. Again, I'm honored to have the team from DiabetesWise with us today. Dr. Hood, can you please get us started and give us a little introduction?
Yeah, great. Thanks so much, Scott, and thanks for having us. We love the work that Blue Circle Health is doing, and been a fan of your work and your advocacy and community building for many years. So thanks for having us. And I've got a great team with me. We all work at Stanford University, and this initiative called DiabetesWise has grown out of some grants that we've gotten, largely from the Helmsley Charitable Trust. And so I'll talk a little bit about that. And then we've divided up the presentation, and we're not going to talk for a long time because we want to hear your questions and have time for some discussion. But as we go through, we'll introduce kind of the next member of the team and tell you a little bit about some of our areas of specialty and the things that we're most interested in. Quickly, I work at Stanford University as a professor and staff psychologist. Have been interested in the psychological side and the behavioral side of diabetes, and have type 1 diabetes myself and celiac. And so it's the things that we're thinking about, and I really like the way that Scott started it. We just want to give people the right information, give them, empower them to kind of make different decisions related to devices and technologies. And if you're not ready for them, then maybe some of the content that we have on DiabetesWise can help you move a little bit, be a little bit more comfortable in that. So I'm going to share my slides and then get us started. And let me know, Scott or others, if there's any issues with seeing this. But so as I mentioned, DiabetesWise is a digital platform. If you go to diabeteswise.org, you'll find it. You'll find a lot of different resources there. I want to acknowledge, as I mentioned, the Helmsley Charitable Trust in supporting us, and also Stanford University, since it's where we all sit and we all practice. So there's certainly in-kind support from them. We are registered as a 501c3, a nonprofit organization in California in the United States. And so that also speaks to one of the other points that Scott made in our early work with Helmsley. We wanted to make sure that this was something that was accessible to everybody and that we weren't pushing certain devices or certain products. We wanted to be brand agnostic. We wanted to give everybody the information and let them decide. We certainly have a bias that these things could be helpful, but we also want people to make their own choices. So our goal really is to help people with diabetes find the devices that fit their lifestyle. We do this through a couple different ways. One is, which you'll hear a lot about, some of the offerings on DiabetesWise, but we also have a community forum that's relatively new and growing called Diabetes Wiser, where people can post and get some additional information. We have had some Ask the Expert sessions that are popular, and people enjoy getting that kind of direct information from endocrinologists, people that live with type 1 diabetes, and others. We also have one that is dedicated toward healthcare professionals called DiabetesWise Pro. And I'll talk about, as we go through, the team is going to talk about a few of the different offerings that we have in these different places. If you go to DiabetesWise.org, you're going to find a couple different resources when you land there. The first one that tends to be one of the most popular things that people look at is the device finder. And you can see an image here of a couple of the different devices. So these are automated insulin delivery systems. You can see across the top, you can select, I just want to look at glucose monitoring. I want to look at insulin delivery. I want to, and there's a feature called compare devices that someone's going to talk about later. But here you can get a lot of different information. You can expand it out. You can add it to compare to others. So if you wanted to look at, for example, the tandem one here with other ones, you could do that pretty easily. And what we're thinking about with this is that we really give people kind of a landscape of what's available, and if they have certain features that they're interested in, they can read about them. They can hear some information. Sarah's going to talk about the wisdom section. So this is really one of the main kind of core components of DiabetesWise. One of the other things that we did was we wanted, when we started this all the way back in 2019 and really kind of launched a lot of the programs in the early, 2020. And so we really wanted people to be able to put in a little bit of information about themselves and have that give them a tailored experience through this. So to walk them through what might be something that they're interested in, what might be helpful. And so this is why we created this checkup, or a little bit of a quiz to get started. And so there's just 5 or 6 questions that are part of this. It really gets at, what are you interested in? What have you been doing? Do you find yourself distressed about different aspects of technology? Do you find yourself frustrated with some different things that you've tried? And this gives us the opportunity, based on kind of the background algorithm on the website, to kind of push you in a certain direction, so that on the device finder, you might see some things that might be a better fit for you based on your responses. So those are a couple of the main features, and you're going to hear more from me as we go along. But now I'm going to turn it over to Sarah Haynes, who's a data analyst at Stanford University and has been we've worked together for quite a while. And so, Sarah, I'm going to turn it over to you and hear a little bit more about yourself too, if you don't mind.
Yeah, thanks, Corey. Like Dr. Hood said, we've worked together for, I think we're coming up on 12 years or so. I also live with type 1 diabetes and getting close to 40 years. So sounds like a long time when I actually say it out loud. The wisdom section that we offer on DiabetesWise is actually one of my favorite pieces of the website. We've interviewed a lot of people who use different devices, and some people who don't use devices, to get their feedback on what's working for them, what's not working for them, tips, how they manage certain situations. And I think the wisdom pairs really nicely with the checkup, because the checkup, kind of assesses where you are right now, what's working for you right now, what do you want right now. But it's hard to know, what your future needs are, or like what people's real lived experience with devices is. And so I think the wisdom is a great spot where you can either read about what people are using and how well or how well it's working for them, or if it's not, and then tie that into your own life, and just knowing, how I operate similarly to this person, or I don't. And so I think it gives a kind of a more real world picture of living with diabetes devices. And so it helps you move from like, is this right for me, to like, I can see this working for me, or, the flip side of that, like, this will absolutely not work for me for, X and Y reasons that you don't always see, like in a product guide, or things like that you get from industry, or just get from the more general information that's out there. And then I'm not sure who was. People were passing to Lauren.
Yep, that's me. Hi, everyone. I'm Lauren Figg. I'm a program administrator at Stanford in the Division of Endocrinology and Diabetes, and I work with the DiabetesWise team. One of the more recent and really exciting additions to the DiabetesWise website are exercise resources. So we had some funding from the Helmsley Charitable Trust to really kind of amplify work around diabetes and kind of the interconnection of diabetes and devices and exercise, and really with the goal of helping people to feel more comfortable and confident in managing their diabetes during physical activity. So we have this initial landing page and a lot of different topics that we have added and are consistently adding to, really to address the needs of people with diabetes who are interested in, again, more safely and effectively exercising. Concerns about hypoglycemia or low blood sugar is one of the biggest barriers to exercise, and really presents a lot of diabetes generally presents a lot of unique challenges. And so, again, because this is such a common concern or common challenge for people with diabetes, we wanted to ensure there's a lot of different resources to support those who are looking to exercise. Go to the next slide. So one of the things on the exercise resource kind of page is a really detailed breakdown of how activity features like exercise mode or activity mode or temp targets can be utilized to help increase safety and efficacy of exercise for people with diabetes on these different systems. So it has, every system has a different name for this, but similar kind of desired outcome, I suppose. So it breaks down the standard glucose target, so you have an understanding of where your pump is trying to keep your blood sugar during exercise, or just normally, and then with exercise as well. And then the effect of that. So it really tells you the nitty-gritty details of the way that the algorithm is working to help support blood sugar management during exercise. And this is preventing both high and low blood sugar. Next slide. And then a lot of the resources that we have look similar to this. And so we have a lot of narrative, kind of text-based education and information around topics such as tips for preventing and treating low blood glucose levels during exercise. A lot of the content that is on the website is supported by a exercise physiologist, Dr. Desi Zaharieva, who's done a lot of work specifically in type 1 diabetes and exercise. And so everything on the entire website, but including on the exercise portion, is very evidence-based, very cutting edge. We have a lot of the newer standards of care and consensus guidelines around exercise. And so you can rest assured that the information is evidence-based, and really the most recent recommendations for how to manage type 1 diabetes and diabetes generally when you're exercising. I also want to make a note about DiabetesWiser, which Dr. Hood brought up before. There's a lot of conversation in the community forum around exercise that really gets a little more niche and individualized. There's a lot of information on the exercise pages that I would really encourage you to check out, and interesting kind of case recommendations for things like altitude or extreme weather. But a really interesting application of some of these is in that community forum where you can say, yeah, I learned about this stuff on DiabetesWise and I applied it here and this was my outcome, and really get some kind of real-time feedback from people who maybe have experience in the same thing. So I will pass it to Selma.
Thank you, Lauren. Hello, everyone. My name is Selma. I am one of the content managers at DiabetesWise. I've been working at Stanford for about coming up on 5 years. I also am living with type 1 diabetes. It's been almost 20 years, which I don't think I've said out loud, but there's always a first for everything. So we're going to switch gears a little bit to the healthcare professional version of DiabetesWise. So you'll see that we changed from the blue to the purple, and that's how we distinguish between the two different websites. You can toggle between them. So our next set of tools really are designed to be specific to healthcare providers. However, they can still be used and are open to be used by people living with diabetes. Really, our intention with building the healthcare professional version was to be transparent and to provide information that is needed to make the informed decisions that our team has been talking about. So we've worked with various healthcare providers to kind of lay out the ground for how the professional side would look. So you'll see that you're able to see the same content that's on the patient version on the provider version. So you can compare the different devices, you can look at the different devices, and you'll see that there's some slight differences. So on the provider website, with the compare tool, there are several tools that go into pharmacy, DME, how to get the prescription through, prior authorization, and tips and tools around that. So it's also important to keep in mind that oftentimes healthcare providers will try to keep up to date with all the devices coming out, but you'll see on DiabetesWise that just for diabetes alone, there are so many devices out there, so many different options, and they have slightly different variations. So looking at those and comparing them, and as Sarah mentioned, what works for you might not work for someone else, and vice versa. So it's important to gather all of those details. So that's what you'll see pretty much when you look at the device library. And then moving into the prescription tool, if we go to the next slide, yes. The prescription tool is available on the provider version only. It's available to the public. It has tons of data in there. What you'll do is you'll select a device. So any of the devices currently listed in DiabetesWise have information on them. And then you'll select your state and you'll select whether you have Medicaid, Medicare, or private insurance and the specific insurance plan that you have. And if that data is available within DiabetesWise, you'll click Get Order Support. And what you'll see from there is whether or not that specific device is covered by your insurance plan and who carries it. And this is important information to know because sometimes you'll see that it's covered by pharmacy or it could be covered by DME, which is a durable medical equipment company. So what ends up happening oftentimes and what we see with patients is they'll have a prescription written and their insurance won't cover it and it'll be rejected by the pharmacy. However, they could be approved for that prescription if it went through DME. So it's important to really know what your insurance entails and what the specific things that your insurance has listed for you. And then the other thing is prior authorization. So a lot of these devices, unfortunately, have prior authorization. Some of them don't. It really depends on the insurance. But the prior authorization is a quick process. I didn't mention this earlier, but I am also a student pharmacist at the University of California in San Francisco, and we do prior authorizations all day, every day for patients. And it's really easy. It's a system that runs through the health system that we have online, and most providers know how to do this. So as long as you know that that's what you need to do, it's good to follow up with your healthcare provider and then just double check on that. And then the last step is to prescribe, which you won't be doing. Your healthcare provider will be doing that. But I will go ahead and pass it back to Dr. Hood for DiabetesWiser.
All right. Thanks, Selma and Lauren and Sarah, for all of that. I'm going to finish up in just a couple minutes with just a little bit about DiabetesWiser, and I'm hoping maybe Sarah chimes in. Sarah's been instrumental in getting this to where we want it. But I was thinking, just as someone was talking about the prior authorization, and one of the things that we were hoping to create was a place where, somebody could come and they could say, I was rejected or denied, the prior authorization didn't go through. What do I do? Who do I bug? Who do I call? And so we were kind of hoping that, this forum allowed people to do that a bit more than maybe what's available, and to do it in an organized way that's connected to devices. And so what you might see here, and you can see the different themes here, in November, I think it was November, we had a topic with Dr. Marina Bassina about adjunct therapies related to insulin and how they might affect exercise. And so, there was dialogue there, and a couple things you can do. You can click on that within DiabetesWiser, and you can get a summary of it. You can view the information, and we're trying in this way to get a lot of kind of practical knowledge out there that maybe isn't shared, maybe is shared like person to person, but isn't sitting somewhere. I don't know, Sarah, did you want to add anything? I mean, I don't know, you were instrumental in kind of some of the early work on the G7 versus G6 versus G7, like some different things like that.
Yeah, it's just I think the community is a nice place where if you have one of those like very specific, kind of very niche questions about something, it's kind of a catch-all for all that stuff. And, I know there's other groups out there that are more kind of topic based, but this is, if you have a question about everything, this is a place you can come. And I think one of like the early questions we got was from a surfer who was like, where people who surf, where are you putting your devices? He's like, I rip them off when I put them on my arms and my legs with my wetsuit. And so, got some good feedback on that, and on, other people chimed in with like, you can try, like there's device guards that, if you absolutely want to have stuff on your arms and that's a problem, you can try a device guard to keep it on while you're, taking the wetsuit off. So, it's just it's a nice spot where it doesn't matter what your question is. Someone out there has the answer for you.
Great. Thanks. And so just to kind of wrap up, just kind of reminder of like, with all of this work, and someone said it well in terms of like, you can, as a person with diabetes, as a person caring for somebody with diabetes, as just somebody who's interested in it, you can access all of the data. It's all free, all publicly accessible. You may find a tool on the pro side that is a little bit more helpful than some of the others, or vice versa. And so you can look in all these places. But really, ultimately, we wanted to be able to give people the tools so they feel empowered and educated about different devices and technologies that are going to fit their lifestyle. There's a couple, I'll leave this up for a minute or two while we wrap up, but here's a couple, if you want to scan, if you haven't already done that as you're listening, but there's a way for you to scan and then use these QR codes to get to the different sites. With that, I'll say thanks for listening. We're here. We're going to talk for a while now. but hopefully that gave you a little bit of an overview of why we created this platform and what we hope to do. And we're constantly working on improving it and refreshing it. And so hopefully you'll be excited about other things that we launch this year. So thank you, Scott.
Yeah, wonderful. Thank you all so much for sharing this information. And I would love to be able to send a copy of the slides out with a summary email.
Sure.
If you are comfortable with that. And several just thoughts before I start diving into the questions. We've got a great flow of questions coming in, so that's amazing. I love, Selma, that you talked about the burden on our healthcare professionals to stay up to date with everything that's happening in this field. It's moving so fast, and I just can't imagine the pressure they feel. So I just appreciate all of you taking time to help make their lives a little bit easier too, because that in turn makes a lot of our lives easier. I did have a question specific on the insurance side of things. That's where a lot of us often get hung up with challenges. How often do you run into the difference between maybe a widespread plan that's offered by one of the carriers versus perhaps some limits that a specific employer who's purchased a plan there might put on that? And how do you deal with that in that tool that you shared?
Well, I don't know that we do it well. I'll say that to start. I think that a couple of thoughts I had on it. I mean, one is that in the last few years, you've seen this huge shift from often covered by DME to then more people being covered up with their diabetes supplies to a pharmacy benefit. And so that shifting has changed some plans, and then they're constantly updating and changing plans every year. And so we do our best to keep up with that. What I think we do well with the tool is give you, kind of the two main like pain points. I think one is understanding if it's covered and understanding if prior authorization is necessary. I think we do that pretty well with them. And then in terms of like copays, if some subset because of an employer plan takes it away, like we don't do that as well because that's I think harder to stay current with. So I guess that's maybe the best answer I can give, that I think that we do it fairly well, but it's not perfect.
I think it's hard to be perfect and navigate the insurance landscape. So this is a terrific place to start. Comment from one of the attendees, audience members, sharing that she's had type 1 diabetes for 42 years, been on an insulin pump for 30 years, and there's so many choices when it comes to insulin pumps. How do we know when it's time to switch to a different type of pump that might have more technology? She shares she feels a bit overwhelmed. Where would you suggest someone sort of interface with DiabetesWise to ease some of those feelings?
I can jump in on this one a little bit. I was one of those people. I used a Medtronic pump for the better part of 20 years, and then moved over to a Tandem pump, like kind of right after they first came out, before all of the AID tech. And I mean, for me, it was honestly just the pump functioned like a phone, like it had a touch screen, and it was a purely aesthetic choice for me. So I think sometimes it's just as simple as that. Like you might just be bored with what you have. I mean, the landscape is quite different now with all of the different algorithms, and that gets a little harder to pick through. But I would just go back to like on a base level, like I said, I used a Medtronic pump for like 20 years. I used a Tandem pump for another 5 years. And then I've been heavy in the DIY space since that came out. So like when Loop came out, I was, did that from the word go and was using an ancient Medtronic pump held together with bubblegum and duct tape. And when that finally went, I had always been fine with a tube pump. Like it was a non-issue for me. It was never anything I thought about. But then I bounced over to pods once, you could use those with the DIY systems. And I will never go back on a tubed pump. Like, I had no idea what I was missing. So, I mean, again, sometimes it's just as simple as I just want to try something different. It has to do with like your level of risk taking. But also, like I said, I was on a Medtronic pump for 20 years and I was fine. Like, so sometimes you're fine with what you have. And if you're kind of risk averse, it's fine to stay with what you have. And then other times it's like, this has a better screen. It looks less medically. And then, of course, there's the medical end of it. Like, this algorithm works better. Like, I know people who use this, and, there are differences with algorithms. And I think that's, again, why part of what I like about DiabetesWise and DiabetesWiser is like people can talk about the nuanced difference between how something works or even just how something feels on your body. And so that's one of the really great things that the site offers, is just kind of those smaller differences between things that you don't get reading a brochure.
Yeah,
I'll piggyback. Sorry, Scott. I was going to piggyback on that as well, and just mention like the wisdom page that Sarah is mentioning here and had talked about during the presentation. You can find like some examples of people that have potentially similar lifestyles as you, and understand how that pump fits in with their lifestyle. An example I can give, that is probably not all that common, but comes up a lot in our discussions around the exercise work. Our exercise physiologist does jujitsu, and she talks a lot about the benefits or pros and cons of like a tubed pump versus an untethered pump for contact sports. And so again, very niche, but this is the kind of thing that you can get into a little bit. Like, yeah, this is the kind of thing I do. And I've never thought that there might be an easier option for me to engage in this part of my life while I'm managing my diabetes. And so the wisdom and then the device comparison or the device checkup are great ways to start to explore some of that, even if you're just curious. I saw someone mention in the comments that you're locked in for 4 years. And so if you're not at your 4 years yet, if your warranty's not up, it's a good time to start poking around. And then, if you have a little bit of an opportunity to compare what the different systems are that are available.
I also really love the checkup feature, right? And that's something that can kind of walk someone through what they're currently using. What are the things they're maybe looking for? I also really appreciate that it's not all just technical jargon. There's a lot of like how are you feeling about interacting with your devices, and I think that's a very important aspect too. Selma, I saw you come off mute. Did you want to add something?
Yes, Scott, thank you. I was just going to mention that there are also a lot of trial programs. So it really depends on the device, but things like patch pumps and even CGMs have trial programs, and you can do like a 7-day trial, a 30-day trial, and oftentimes they are free. So I didn't learn this until later in life, but it's always good to call the company and just ask, what are the steps to get this? You might need a prescription for it, and then you can go to your provider and have all of that information. But I think that's a really great tool, because for me personally, I tried out the patch pump, the Omnipod, and it didn't work for me. I personally really like the tubing pump. So it just depends on the person. It's different, depends on your lifestyle. It could change depending on what you're currently doing, what kinds of exercise you're doing. So those things are really good to keep in mind when you're trying out new devices.
Yeah, those are great points. Thank you for adding that. Sarah, you mentioned being involved in DIY and Loop and stuff like that. Can you talk a little bit about how you at DiabetesWise managed to incorporate some of that information while also having to sort of walk that fine line of approved devices versus unapproved and things like that? I think that's something that many of us are curious about.
Yeah, for sure. We do have information about the DIY devices. We offer kind of more of a one pager on them, just explaining what they are, and then I believe we link out to the different DIY options. And there's a small handful of them out there. Most of them have really, really good documentation about, if you're interested in this, this is how it works. This is what you need. This is how you can put it together. And like Scott mentioned, like they're not, by and large, they're not FDA approved. Tidepool does have an approved version of Loop, but there is also still DIY Loop. I know for a lot of people, it's a ton of information. It's super overwhelming. But again, the documentation for most of these is pretty straightforward, and they kind of walk you through step by step by step. So, if it's something you're interested in, it's definitely worth taking a look at. And the commercial systems are catching up. I mean, I think there was a really strong interest in DIY when it first came out because there were no approved algorithms. And, once Tandem came out with Control IQ, a lot of people did move off of Loop onto Tandem because you do have like built-in customer support and that kind of thing. And the DIYs, like, you're not on your own. There's a large community, and generally speaking, people who can offer help at all hours. But there's still some level of risk associated with that, and it's not approved. So this is something you're doing on your own, and so you have to be kind of okay with that level of risk. But again, with DiabetesWise, we acknowledge that it's out there. People use it. I use it. Like I've used Loop. I use Trio, and I think it would be a mistake to pretend that those things don't exist and that people don't use them.
I agree, because we know that people are going to go out there and find information and do their homework. And I think it's smart to acknowledge that. And I appreciate that DiabetesWise does such a good job of that. With touching on the exercise aspect of the resources that are there, that has had to have moved really, really fast, right? That's something that I struggle with when I first moved to an AID system, was figuring out how do I exercise with this automated insulin delivery device. Can you talk a little bit about what that process was like to get that started, to recognize the need for it, and how that evolves? And maybe Dr. Hood will start with you for that one, unless you want to direct me somewhere else.
No, I can jump in, and then I'd love to hear, Lauren and others' thoughts on it. So I think I guess I would say first that, I think exercise or any kind of movement, it always creates problems for people with diabetes. And I mean that to say that it's not just something you can go out and do, even if you're walking around the block, versus like, scaling Everest. Like you have to think about it. You have to be aware of different things. You have to plan. And so it's a complicated and kind of complex experience. And so what the kind of frame that I think we've tried to adopt on DiabetesWise is that there are tools that can help make this a little bit easier. And some of the things that Lauren showed, the guides about what you might want to do in different situations based on a system that you have. I saw in the comments someone doing it old school with, injections or a pen or things like that. And, we have resources for that person too. It's not just about utilizing the devices in that way, but we're trying to make this complex experience of exercise, fitness, movement just a little bit easier with these devices. And so there's a lot of resources and content on that. One of the things, Sarah brought this up, and then Lauren also talked about it from a jiu-jitsu perspective. Like anytime you sweat, like there's a million different things that could happen with your devices. And so we have a page that has the different kind of tapes and covers and different things that you can do. So there's that kind of information that I think comes up on wisdom and is a nice feature related to the exercise piece. But others want to jump in. Maybe there's some specific things that could be helpful if anybody else wants to add.
Sure. One thing that I'll mention is, and you're right, Scott, that there's a lot of like changing landscape on the tech side and just recommendations about exercise, not just for people with diabetes, but broadly, the recommendations for a weekly movement have changed a lot in the last many years. And so, the ADA and ISPAD and all of these governing bodies within diabetes kind of adjust to that too. One thing that is really nice that's on the website is from the exercise and AID consensus guidelines. There are PDF copies of kind of device-specific recommendations for how to manage your pump and treat lows during exercise. So it's like a circle, kind of like a wheel image, and it'll say what the recommendation is for turning on an activity or exercise preset, if it's 90 or more minutes before you start the activity, and then how to kind of manage during and after the activity as well. And those are by system. So that is very unique to whatever you're using. And those are, I think, really useful for kind of taking some of this from like an academic paper or, some clinical guideline to really like the application of how do I make this system work for me.
Yeah, great. Thank you. Can we shift a little bit to talk about taking some of what someone might find on DiabetesWise and using them to have a more sophisticated, more evolved conversation with their doctor? A comment in the chat here is about finding the right partner with the doctor, and sometimes we're not privileged enough to be able to pick and choose what healthcare professionals we see. Are there resources in DiabetesWise that might help facilitate some of those conversations?
Yeah, I think the ones the kind of go-to ones that I can think of are, we have, and I can throw the link in, but some ways to kind of advocate for yourself in educating your provider about these different devices and different options. I think that's one. And then there's a lot of really good stories in the wisdom about ways that people have done that. I think that, I see its comment, and I think it's really important to find a provider that you feel like is a partner in this versus just going to tell you what to do. But it's hard because, across the 25 or more years, for me, it's been, I've probably had 15 different ones. And sometimes it's just because I get bumped to a different plan and then I have to go to somebody and don't get to see the person that I liked. And so, but a couple themes are to, to talk about what you're, to bring up, to have a plan anytime you go in for a visit or anytime you send a message, to say, hey, this is something I'd like to talk about. This is something I'm interested in. I read about this, but what do you think? That's an important thing for ACPs to often hear is like, I did a little bit of homework, but what do you think? Because they have that, they'll want to kind of weigh in on that. So, I think that there's a few of those parts that I think you can do to advocate for yourself. This is, so much of what you're doing to take care of diabetes, 99.8% of it is outside of these kind of visits, but these providers offer kind of a gateway to be able to do those things. And so I think you just have to be kind of pushy sometimes. I don't know others if you have different perspectives on it.
Yeah, I agree with that. depending on your view of things and where you're at, like diabetes is just one of those conditions where, if you can advocate for yourself, like you're going to have an easier time getting the things that you want and need. Most of us are fortunate enough. We live in an area where we can, like, if we don't like our endo, we can go find another one. But I recognize that's just not a reality for a lot of areas of the country because you're so far away from care. So in those instances, I would just, educate yourself as much as you can on what, device you're looking at or what you want to switch to, and, try to condense that down to like a 5-minute conversation, because we all know the visits last like 3.5 minutes, and just say, this is what I want. This is why I think it will help me. And, if you can't help me with that or are uncomfortable with that, can you point me to someone who can? And, I think telehealth has opened up, opportunity for people who are in harder areas to like switch providers to see someone else, because you're not, you don't have to drive out constantly. Like you can do some of the appointments over Zoom or over the phone. So yeah, if you do find yourself stuck in one of those circumstances where they're just like, nope, I don't do this, I would try to get referred out and then, utilize telehealth as much as you can. And, if you are in an area where you have access to multiple providers, try with one you have. And if it's not working, there's nothing wrong with seeing someone who's more aligned with what you want to do. You're the person who deals with this, not them.
And you don't have to disclose any, Sarah, but I think Sarah's had a recent experience where, and I think we've all had this, where you're turned down for something that you're asking for. You want a certain device, or you want a certain medication, or you want a certain thing, and the provider says no, or the system says no. And I think one of the things that we try and encourage people to do, and I do this clinically too, is just to kind of keep pushing on it. Don't accept no, and don't accept no the first 3 times that you get it. And it takes a lot of time, and it's hard, and it's annoying work, but ultimately, I don't think the system is built to give us everything that we want and need, and so we often have to push back.
I think that's a really great point. And the other thing too that comes to mind when I'm thinking about scenarios like this is that there may be some reasons behind why they're saying no. And it's up to us to ask about those, right? To get in a conversation about what are your concerns as my medical provider, and how can we then talk through some of those concerns to get you to a point where you're comfortable with this proposed change. And it could even be something as simple as unfamiliarity, or where you might be able to get them to let you try it for a quarter, or some kind of a mutually agreeable process that you go through. But I think it's all about those conversations. So really great points there.
I'll mention really quickly too on your point, Scott. I worked on Project Echo Diabetes for a long time, which worked with primary care providers and really helping them feel more knowledgeable and comfortable with treating type 1 diabetes. And one thing that came up a lot and was really around, like, they didn't know what to do after someone got the pump. How do I look at the data and how do I interpret that and give you feedback about it? How do I keep you safe as a patient? That, some of them didn't even have like the platforms necessary to be able to interpret data or have any diabetes educators on staff. So that's, I appreciate your mention of like, ask what the concern is, because sometimes it's just that they're not really equipped at present to, see this through. Because like, again, someone said in the comments, it's like 4 years that you're locked into a pump, right? So they understand that commitment as well.
Yeah, great point. Thank you for adding that on. One of the challenges that I imagine you face as an organization is keeping up with this rapidly changing field of technology in diabetes. How on earth do you manage to do that?
I mean, I will say it does help that all of us are living with diabetes, so we tend to stay up to speed on all the new things that are coming out, and we do our best to get new, like when a new device is approved, to get it onto the site. But yeah, I mean, I guess I would say that our experience is our greatest asset in that. Like we like most of us live with diabetes, and so we keep tabs on stuff.
Yeah, no, I think that's absolutely right, and it's even it's like having a great team like this and a big team allows us, like, if somebody doesn't notice something, then somebody else will, and so that's part of it. And then I think that we also don't feel like we have to be we don't have to have all of the information to make it helpful to people. And so if something new is out, but we don't know a lot about it yet, then let's put a little bit of information on there. And then as we learn more, we'll add to it. But sometimes like this feeling of it needing to be perfect or totally comprehensive doesn't work well for, I think, this kind of resource, and doesn't often work well for people in general. Like try different things. And I will say the thing that is hard to keep up with is, for example, the prescription tool has it relies on, and has relied in the past on, what payers report that they do. And so if you've got a new device that's just out, maybe a new version of a CGM that you like, or a new pump, there's not a lot of data on it for a while. And so it's not always clear if that's going to be covered and how easy it is and things like that. So that part of it, I think, lags behind, but getting the technical details about it and the information about it usually is a little bit easier to do.
Yeah, that's great. Thank you. Has there been a focus from you, Dr. Hood, as you have worked to sort of spearhead this movement to make DiabetesWise more than, just a up-to-date diabetes tech resource, which it is, but it also feels like much more, and that also feels very intentional. Can you talk a little bit about your mindset around that?
Yeah. Well, I think some of the things that we've tried to do, and we're currently running a study now, is trying to understand how people use the information. And then once we learn how they use the information, and maybe it translates to them asking for prescriptions more, or it means that they, reach out to, a friend about what a device might be, or things like that. So once there's some change or some movement for people, trying to adapt and kind of sustain people's use of it. So we really like it to be a tool that not just kind of educates, but actually moves people along and helps them make some decisions about things. The study that we have going on right now is doing that with exercise, and Lauren's one of the leads on it. And it's trying to understand that the content that's on DiabetesWise about exercise, how do people use it? How do they interact with it? How do they apply it to their daily lives? And then if it's working well, then let's promote that. If it's not, then let's find something else that is working. And so I think that we're constantly, the eye is not just on education, but on kind of moving people along in their journey of, maybe it's better health, maybe it's adequate health, whatever they want to think about it as, but hopefully moving them a little bit along in that journey.
Yeah, that's great. Thank you. When we think about maybe someone who's new to DiabetesWise, and they're using DiabetesWise, and they realize that they want to switch the technology that they're using, is there a first practical step? Is it talking to their healthcare team? Is it checking with their insurance? Is it the device company? Like, is there a one way that this happens that is most common, or is it like much of our diabetes, it's a little bit different for all of us?
You know, I would say, and I appreciate others' perspectives too. I do think it's a little bit different by person. One of the things that we did early on was trying to understand different people who come to the site and like maybe what their persona is. Some people are, and you've heard a little bit of this in the comments. Maybe there's a reluctance to rely on technology. They need something different than the people who are like, I love data. I want as much data as possible. And so trying to, we want to kind of tailor it for people's needs and for their experiences. I think Selma, you were going to add something, I don't know, along those same lines or something else.
Yeah, Dr. Hood. So I was just going to mention that exactly what you said. So I think it's different for different people. It really depends on your personality. You can start at different places and end up at the same place. Some people like to check in with their insurance first to see what's actually on their plan, their specific plan, and not something that you may find online. Other people will kind of gather the different resources and the different devices that they might be interested in. For example, like using the checkup tool on DiabetesWise is what we've seen people do a lot. So it really, I think, is an individual experience and kind of depends on how confident you want to feel going in to talk to your healthcare provider. I mean, oftentimes people are coming in and they know more than the healthcare provider about that specific device, and they're all set. They're like, these are the options that I have. Which one do you think is going to work the best? Which, we've talked about that shared decision making. Sometimes the healthcare provider might have some insight that could help, that although you are the person living with diabetes and the decision is ultimately yours, might help give some perspective on things that might work slightly better. So talking about those things is really important. So yeah, that's just my perspective, what I've seen and what I've experienced myself.
Yeah, thank you for that. And
I'll just add to that. I agree. It's very kind of individualized. I'm very fortunate. I have, a lot of friends with type 1. I went to summer camps when I was a kid and, grew up with people living with diabetes. And like most of us are all very different. Like I want the latest and greatest right now. I wanted it yesterday. And then I have another friend who has been on shots the entire time. He only started a CGM like a year ago because he's just like, nope, don't want it, don't need it, don't want to have anything to do with it. And then, another person is, a kind of a cautious tech user. Like she was late to get on a pump. And then once she was on a pump, she didn't want to switch to anything, and she clung to her Animas pump until you couldn't see the screen anymore because she's like, nope, if it works, I don't change it. So, and again, I'm a big wisdom cheerleader for the wisdom section of our website, because I feel like, if you don't have a lot of people in your life who also live with diabetes, it's a great resource to just hear what other people are experiencing and feel like. And, if you feel like you identify with someone, you're like, oh, maybe that might work for me, or maybe it'll confirm that, what you're using is working for you. And are you just feeling pressured to change just because, or, so it's good to just kind of take a step back, and the checkup tool is useful for that, to just say, like sometimes it's okay to be okay with what you have.
yeah, I always like to think there's no such thing as small change in our lives with diabetes. Everything is, we've built up habits or preferences or whatever. So, yeah, I love that. I love that mindset. Well, just keeping an eye on time, I want to come through and ask each of you for final thoughts, or if there's one thing you want someone to take away from watching this webinar. And Lauren, I'm going to start with you, if that's okay.
Sure. Thank you. I would just really encourage folks to check out the DiabetesWise website and get on our mailing list so you're aware of the updates that happen. And I'll do a special plug for the exercise resources that are brand new, very up to date, and really want to get people to visit those and get some new ideas. And it's a new year. A lot of people have resolutions, so fits in nicely.
Yeah, thank you. Selma, how about you?
Thank you, Scott. I encourage everyone here to engage with the Diabetes Wiser community. I think in healthcare, really the key is building that community. And that's what we're trying to do with Diabetes Wiser. So even if you just want to silently read what other people have posted, and then once you feel comfortable, if you'd like to post yourself in any of the Ask the Expert sessions or one-off sessions, we're happy to respond to any questions that you have.
I love that. There's so much value in just reading what's already out there. So thank you for mentioning that. Sarah, any final thoughts from you?
Yeah, I would just say the most important thing when you're trying to figure out, if you're trying to make a decision about what device to start or what to do is to, know yourself so that you know what you want. I think a lot of us living with diabetes have spent a large swath of our lives being told what to do or told what we need. And, it's a good idea to just take a step back and, what is it that I want? What is going to, help me the most? And, sometimes that's glucose control, and sometimes that's just personal well-being. And, to just pause and just think about what it is that, what do I need?
Yeah, absolutely. Thank you. And Dr. Hood, how about you?
I think there's been such great comments from everybody, and I really appreciate what's been in the chat. I think maybe I want to echo what you just said, Scott, about the small change. Like that, I think that that really is true of what we've tried to produce on Diabetes Wise. Is that you're making some kind of change even by reading the content. You're making some change if you think, oh, I just want a different pump cover. I want somewhere else to put it. What do other people do? Like these things are really important because, as you all know, like it's a slog, trying to take care of diabetes. And so any of these kind of small little things you can do, listen to stories that other people have, that these kind of tiny changes maybe add a little bit of a refreshing feel to it, even if it doesn't last long. But I think that's also one of the things we're trying to capture here is just helping people move a little bit. You don't have to make huge traumatic changes. Just these kind of subtle little small changes can be really important.
Yeah, thank you for mentioning that. I agree. One of the biggest takeaways for me is that feeling unsure about diabetes technology, it's actually quite normal. And it's what I appreciate so much about Diabetes Wise is you don't treat technology and technology and diabetes as a one-size-fits-all solution. Instead, you're helping us ask better questions, understand our options, and make choices that really align with our values. So just to the entire Diabetes Wise team, thank you for your time, your expertise, and all the care that you bring to this work. You're really helping people navigate diabetes tech in a great way. All right. Well, you all can feel free to, Diabetes Wise team, feel free to drop off. I'm going to spend a few minutes doing some housekeeping. You're, of course, welcome to stay as long as you like as well. But I just wanted to be conscious of your time. And again, thank you very much. So everyone watching, thank you all so much as well. We'll be sending a follow-up email with the recording. I'll be sure to pull out any links that was shared by the team in the chat and include those, as well as a copy of the slide deck. And then please do remember to check our website events page to stay up to date on future Blue Circle Health events. And that's all at bluecirclehealth.org/events. Speaking of events coming up, we do have a virtual cooking class on Monday, the 26th, where Rita is going to be teaching us how to prepare sauteed tilapia with green beans and relish. And then on February 11th, I'm excited to have Mila Clark here to talk with us about the importance of finding community in T1D. Also encourage you to check out our podcast. It's called Around the Circle, Living Well with T1D. And you can find that on all the usual podcast platforms, including Spotify, Apple Podcasts, and more. So thank you again for being here and showing up for yourselves. If you're new to Blue Circle Health, stick around for a few minutes. I'm going to share a brief overview of our free virtual 6-month support program for adults living with type 1 diabetes and answer any questions that you may have. So I'm going to get some slides going here. Thanks, everyone. Right. Okay, so as I go through some of the slides here, feel free to, again, share any questions that you have along the way in the chat, and I'll go through them at the end. This is a very brief presentation, only takes a few minutes, but one of the core beliefs at Blue Circle Health is that people with type 1 diabetes shouldn't have to fight for what they need to live. So Blue Circle Health created a free 6-month virtual clinical care, education, and support program for adults with type 1 diabetes. So you can focus on living, not just surviving. Our mission is to learn the best ways to care for people living with type 1 diabetes, apply those learnings to care for as many people as possible, and then share our learnings to improve type 1 diabetes care everywhere. And Blue Circle Health is made possible thanks to generous funding from the Helmsley Charitable Trust, which you heard a little bit about them from the folks at DiabetesWise. They're a great organization doing a lot of great work in diabetes. So when you think about the virtual care education and support program, what exactly does that mean, you might ask? Well, we offer a free, flexible program to extend care between visits. Our program is up to 6 months long. It's done entirely virtually over Zoom, text, and phone. You stay connected to your medical homes, and we send them regular updates throughout your time in the program. Our services are free, regardless of insurance and immigration status, and re-enrollment is possible 1 year from the original enrollment date. And our program offers as much or as little support as requested. That means that you can take advantage of every service we offer or pick just the ones that you need. The graphic on the right shows the available services, and I'll describe them in more detail, going counterclockwise and starting with clinical care. Clinical care, it's exactly what it sounds like. It's visits with an endocrinologist or an advanced nurse practitioner. We have insurance navigation, which is consultation with insurance specialists who can help you understand and maximize any insurance coverage you may have. They can help you find insurance coverage if needed and help with prior authorizations. Then diabetes supportive counseling, which offers help with the emotional burden of T1D. We also offer case management. Our case managers can help if you're struggling with food, housing, or employment insecurities. We also offer peer support and community. So in addition to monthly group sessions, you'll have a dedicated T1D support guide to work with who will help you navigate all of the other services and just generally be there for you if you need someone to talk to. We also have ongoing community events just like this and connections to other great type 1 diabetes community organizations. We have our education and nutrition. So this is visits with registered dietitians and certified diabetes care and education specialists. There are 2 additional programs available within the Blue Circle Health program. And the first of those are a prescription assistance program for qualified applicants who need help paying for supplies and medications. The qualifications for that is an income level at or below 300% of the federal poverty level. The other program is an Intro to CGM, which provides 3 months of free education and access to a CGM for those who have not had reliable access to one before. We're now available in 20 states plus Washington, D.C., and more coming very soon. And to date, we've helped more than 1,000 participants since January of 2024. So you might ask, what does it take to get involved? And our goal is to make it really easy. When it comes to eligibility requirements, you do have to have a diagnosis of type 1 diabetes. And note, this is not just newly diagnosed. We're here for you really anywhere along your T1 journey, T1D journey. And this does also include diagnoses like LADA. You do have to be 18 years old or older. You have to be able to speak English and or Spanish. You do have to have the ability to connect and participate in virtual care. So that usually means access to a smartphone or a computer for Zoom video calls. You do have to have a primary care doctor or an endocrinologist, or be willing for us to help you connect with one. And you do need to live in a state where we're currently licensed. And finally, no current pregnancy. We can help with pre-pregnancy and post-pregnancy, but not the actual pregnancy itself. Again, the list of states we're available in, it's growing really fast. I can't keep track of what states we're in anymore. So the best thing to do is head to our website, which has an up-to-date list of the most current states. And then you can actually just get started in 3 easy steps. The first is to sign up on our website at bluecirclehealth.org. We'll reach out to you to create a plan that meets your needs, and then you start your T1D care and support program. So I'd like to play a short video from a few of the people who have gone through the program. It's about 3 minutes long, and while that's playing, go ahead and share any questions that you might have in the chat, and I'm happy to stick around and answer them. Here we go with the video.
When I explain it to people, I usually say,
living with type 1 diabetes is pretty burdensome,
complicated. It's really, really tough.
challenging.
Too many ups and downs.
I'm never not thinking about it.
I lose a lot of sleep. It's very emotional.
The only predictable thing about type 1 diabetes is that it's unpredictable.
It makes me feel really vulnerable and afraid. And I don't like feeling afraid and vulnerable with my diabetes.
My daughter was diagnosed when she was 3. You know, if I couldn't afford for both of us to get supplies, and I'll just literally take the shirt off my back, take the insulin out of my body and put it to her.
like, it's a battle every day. And insurance shouldn't be such a fight.
I literally spent days on the phone calling the provider, calling the pharmacist, calling the insurance, calling the pre-op company, and then calling all those people again to tell each other what the other one said.
It's like everyone's pointing their fingers at someone else. In the meantime, I'm watching my supplies dwindle away to nothing.
Like, that's a constant fear, you know?
And so things that feel like a fundamental right are out of reach for many people.
It's just wrong.
A friend of mine on Instagram sent me Blue Circle Health, so I immediately signed up.
Blue Circle Health is a nonprofit with a free clinical care, education, and support program. We deliver our program entirely virtually. It's all telehealth, and it's up to 6 months long.
You get education, you get support, you get assistance navigating insurance. It's phenomenal.
I don't know where I would be right now if I didn't find Blue Circle Health. They picked me up when I was at one of my lowest points.
It's just honestly a godsend.
Felt like they get it. It felt like we're making the change that we should already have. We were really fortunate to have funding from the Helmsley Charitable Trust to make this possible and create this program and be able to offer it for free.
My life has like drastically improved. I have really great insurance. The insurance counselor through Blue Circle was amazing. Not much makes me like that emotional, but like having to not worry about the financial aspect of that as a single mom who's like rebuilding is, yeah, it's really like comforting. Yeah, I'm crying.
And if Blue Circle Health can get out there and show people that this is the right way, it's the right thing to do. You don't have to go through it alone.
Thanks for taking the time to watch that with me. Again, the best place for more information is bluecirclehealth.org. I don't see any questions open in the chat, so I'm going to go ahead and end the webinar. I will get a replay email and some summary notes out in the next few days, but thank you to everyone for joining, and I hope to see you again at a next event. Thank you.